Hi, welcome to Nurse Chats. Today I'd like to talk about getting the most out of your physical therapy session. Okay. I think I've talked about this before. I've had plenty of physical therapy. Oh my goodness. One year I had to have physical therapy 3 times a week plus hand therapy once a week or twice a week. So I was going to physical therapy sessions of one kind or another for 5 times a week. That was after my severe injury where my right femur was shattered and I have a rod in my right leg, and then I broke my wrist at the same time, and the cast caused some nerve damage to my hand, and yeah, not good. But anyway, physical therapy, what I want to say is this. The first time I experienced physical therapy, I had a rotator cuff injury, and I had surgery. And I'm going to talk more and more about rotator cuff injuries on another chat, but that was my first experience with physical therapy, so I was like, I don't know how to put this. I went in there thinking that the physical therapist was going to do something to fix me. That's how I, again, here I am a registered nurse, but I had never personally experienced such a horrible injury. So until I have a personal experience, sometimes I'm, a little hard-headed as far as learning, if not personal through me or with my patients, so I consider that personal experiences when I have my thousands of patients that I've seen over the years. So I kind of have a lot of experience with that. But anyway, the physical therapist, I went in and they're starting to tell me what I need to do. And I was like, huh? What I need to do? I was like, what are you talking about? And I remember saying to the physical therapist, that was, like I said, my very first experience. I've had so much physical therapy since then, but I remember saying, literally, it was dawning. I said, this is up to me. This is up to me, especially with a rotator cuff injury, because, and he was trying to explain to me, if you don't let me, or if you don't do what I tell you to do, as far as range of motion, putting your arm up and back, you're going to end up having scar tissue, and you may have to go back to surgery. And I was like, huh? I had to do it. The physical therapist worked with me, but I had to allow pain. I had to allow time. I had to do the homework that they gave me to get the most out of your physical therapy. What you want to do is you want to go in there with an attitude that you're going to do whatever they tell you to do, and that you're going to cooperate, number one. Number two, you're going to probably experience pain at one time or another during your visit. And you get pretty good at, especially with my rotator cuff injury, well, all of it, my femur and my hand as well. My hand might have been the worst ever, but what I did learn is that I had to put up with pain. And my one physical therapist, it might have been that first one, he said, I remember him saying one time, pain is not fatal. And again, that brain, that brain that was saying survive, the brain wants to resist pain that's severe. And the truth was that it's not fatal, and survival is going to happen. And actually, you're going to be better off if you actually allow pain. So again, he would crank my arm up, and there was a point where I was like this. And if people resist the range of motion that has to happen, they're going to end up reaching for things like that, because they cannot raise their arm up to reach, because they have to now bring their whole body up because they can't use their rotator cuff. And you see that all the time, by the way. I've seen numerous patients with rotator cuff that never really repaired or never was worked on, and to avoid surgery. I wish now I would have potentially worked a little harder to avoid surgery, just because every time you cut the body, you are going to have scar tissue. That is the result of a cut. So, to get the most out of your physical therapy, you need to cooperate while you're in your session. You need to put up with pain. You need to be an advocate for yourself. Sometimes I'd say this, and I need to lay on ice here, or I need to ice your shoulder. Your shoulder ice does way better than any little ice pad I have at home. And I take extra time in the session, and they were very happy to do that and ice my shoulder for me. and or heat or whatever I needed. And those are called modalities. And you can ask for modalities if you feel that if you want more, need more. And I'm not shy about asking for modalities anymore. And there are things called dry needling. Dry needling has some good effects on some people, not on other people, and not everything works for everybody. Cupping's another technique. Dry needling, by the way, is kind of like acupuncture, where you put a dry needle in and the muscle trigger point releases, hopefully. And then cupping is like little cups that suction so that you can release scar tissue. And that's quite the experience having the cupping done. But anyway, the other thing you need to do is when you go home, do the exercises that they told you to do. And 9 out of 10 times, a physical therapist will give you exercises unless you're in an acute post-operative period, probably. They may not give many exercises until you're ready. Of course, you don't want to speed up strengthening. But when strengthening is the time for strengthening and mobility and things are there, you've got to cooperate and do those homework exercises or things that the physical therapist has asked you to do. The other thing you can do is actually support what's going on by taking your vitamins and your pain meds and whatever else the doctors have recommended for you to be doing, and cooperate with that. Because again, pain, we'll talk about pain in another nurse chat, but pain that is post-operative it's different than other pain. And people, as nurses will say, you need to take your pain med. You need to, not think you're being Mr. or Miss Strong by not taking your pain med. Those are very important when you're in the post-operative period. So again, it depends on what stage you're at. But to get the most out of your physical therapy sessions, make sure you not only cooperate within the session, but also when you go home, and actually take it seriously, and you will recover faster. That's the good news. I used to tell patients so many times that were a little less than cooperative and a little stubborn, or thinking they know better than we do, or there's a lot of variety of reasons people don't do what the providers tell them to do. But I would say, this is what you're buying. You're buying less recuperative time if you do what we ask you to do. So example, people with a twisted ankle, if you keep wanting to put weight on that ankle, and when we've told you to rest it and elevate it, it's going to take you my experience was people with twisted ankles, sprains and strains, probably 8 weeks longer, maybe months longer, when they didn't pay attention to what we asked them to do as far as elevation, rest, and ice, and the small movements that are important for range of motion and mobility. That's all I have on that right now, but as always, whenever I get your feedback, I'll probably come up with more later and in the future. So thanks so much for listening, and I can't wait to see you again and look forward to it. Thanks.